Welcome to day 3 of DAM Week. For those that don't know me or are joining in, my name is Rachel Arner. I am a customer success manager here at Media Valley. Today, I am thrilled to be joined by Todd Dubnicoff. Todd is a visual communication specialist at the University of California, San Francisco, or UCSF, as we like to say for short. So very happy to welcome Todd in here today.
Hello, thanks for having me.
Absolutely. Just a little bit of housekeeping before we jump in. We will be doing a Q&A at the end of this session. So for those joining in on the call today, if you have any questions, please drop them in the Q&A tab and we will do our best to answer them. We will also be recording the session, which is great. So if there's something that you miss or you wanted to share the session with anyone after today, you can expect that in your inbox later today in our daily roundup. Always great to reference back to these as well. It's going to be a lot of great discussions. As well, we're going to be putting up a quick poll towards the end. So when that goes live, if everyone could take a couple seconds just to answer that, it'd be much appreciated. But I think, Todd, let's have a chat today. Let's talk about DAM. Just to start us off, Todd, could you just tell me a little bit about yourself and UCSF?
Sure. In a nutshell, I'm a left-handed Canadian who grew up in Texas, and I now live outside of San Francisco, about 20 minutes south along the coast. In another life, I was a research scientist, a biotech research scientist. I have a PhD in molecular biology, and I just figured it was 14 years ago this month that I turned a serious video editing hobby into a second career as a science communication specialist. And so I'm now working as a visual communication specialist at UCSF. And in terms of UCSF, it's one of the 10 University of California campuses like UCLA, UC Berkeley. It's unique among all those campuses in that it's solely focused on healthcare. So there's no undergraduates. There's the health profession training, like there's medical school, dental school, nursing school, and other trainings like that. And then a robust graduate PhD training as well. And so, and then there's overall, like globally, there's a Office of Communications for the whole university. So they manage the main website and our main social media platforms and do the press releases. But a lot of the individual departments have their own communications teams. And so I work on a 5-person communications team in the neurosurgery department. So there's a director of communications, 2 social media managers, a medical illustrator, and then I'm the in-house video producer, and I do some other, graphical type work as well.
Mm-hmm.
Yeah, so.
For sure. No, definitely sounds like, finding that second career has really led you to a great opportunity with UCSF. And as you said, turning a hobby into a career,
Yeah.
that's, what we can all ask for in our lives.
Right.
Turning to DAM and, folks in the higher education realm, it's not an unfamiliar territory to need a DAM, but was just curious, what was really happening at your organization that really led you to look for a DAM in the first place?
Sure. Yeah. So we implemented our dam about almost 5 to 6 years ago. Actually, that was when I was first hired. That was one of my tasks, implemented dam. And at that time, the communications team was growing. And I should add that along with the 5-person communications team, there's about 80 faculty in our department, and then well over 100 staff, nurses, students, fellows, also in our department. And so we were wanting to expand, the communication team was growing, and we wanted to expand our social media presence. And then also the department itself was growing and is growing. We're not just in San Francisco. There's clinics throughout the larger San Francisco Bay Area. And so to do all that communicating, it's a probably familiar problem of having assets all over the place, both geographically and then in terms of in the cloud or in people's hard drives. And so um, we wanted to find a more efficient way of getting at those assets.
Yeah. Absolutely. You bring up, the communications team, and that definitely is again, familiar territory for folks using DAM. Can you describe how you're using Media Valet today with the communications team and beyond as well? I know you mentioned there's about 80 faculty,
Yeah.
but can you describe kind of how you're using Media Valet, how you're using it kind of as a knowledge base for your team and then beyond that as well?
Sure. Should first say that we named our dam Hippo, which is short for hippocampus, which is a part of the brain that plays a role in long-term memory. So we thought that was, being a neurosurgery department, that would make sense. And so it's just kind of fun to have to put a name to
That's
the,
a great name.
yeah.
Yeah.
And so we're primarily we're using it as a curated archived library of the multimedia assets that mostly that we've created. And I would put the emphasis on curated. You can have, so, I'm kind of the main gatekeeper, but my other fellow communications team members are also admins, but we set up the structure and upload the all images that we get. Otherwise, you end up with a, just like a messy filing cabinet in the real world.
Yeah.
And so I would say the primary user is our communications team, for social media assets, for photos, illustrations, for website assets, for newsletters, for sort of outreach. But also our admin team often needs headshots and logos. Just a couple days ago, some graduate students were asking for were looking for photos from a surgery that they were going to use in a presentation. And then other communications team on campus who don't necessarily create a lot of their own content. They often will, some of them have accounts and can go in there themselves to look for photos. And then, so there's that main aspect, the current use, the daily ongoing use, but
Right.
it also acts as a knowledge, institutional or departmental knowledge and historical archive. So for instance, we have a whole archive of brain tumor surgery videos that our faculty have recorded, and those could be used for our residents who are training before they go into the OR that could review those. And also there's a lot of pioneering work going on in our department. For instance, our chair, Eddie Chang, one of his research projects is helping paralyzed people who are unable to speak and using a brain implant that can take the brain activity from attempted speech and decode that directly into speech, directly from brain activity to a sentence on a screen. And we have video and animations, illustrations from that work, and that's, down the line, it'll be good to have. I imagine that could have some historical importance down the line, and to have it in one centralized location is great.
Absolutely. I think, the nickname that you've given your dam, Hippo, I think is so clever and creative, and it really kind of sparks the idea of, a dam, not to get all cheesy with the puns, but it really is the brain of the assets, and being able to connect all of the individuals and the types of assets and all of the creativity there. We could really look at the dam as the brain of your assets, if you will, to make that leap,
Yeah,
if you
I don't
will.
know.
Just curious with the access to the dam and the assets, why is access to these assets so critical for your team, but also for the entire organization?
Yeah, I guess I'll take a big picture view on that. There's a lot of like I was mentioning, the pioneering work at our department. There's a lot of state of the art work, world-class work that UCSF can provide. Our department can provide that other hospitals and clinics can't across the country. So it's important to let patients, prospective patients, and their referring doctors to know that certain treatments are possible. And I think of our communications team as, and all these assets that we have do play a role in getting that message out.
Love to hear that. And,
Yeah.
definitely having the ability to access the assets being critical, but also enabling people to do that almost in a self-serve way, or just gift wrapping them the assets that
Mhm.
they need and saying, okay, here's everything, it's approved, it's good to go.
Yeah.
I know with the organization, getting assets to the right people is important. Can you describe kind of how branded portals has been useful for your team and getting assets out of the dam to users?
Yeah, so branded portals have been helpful. They kind of act like as little mini websites, and they're particularly helpful for sharing assets with people who don't regularly use Hippo. There's either
Mhm.
some faculty members that are super busy or people outside the department. And so for example, I can think of one example where our chair was giving a summary talk about different aspects of our department, and one of the things he mentioned he needed was something with epilepsy. And so we had produced a patient education video talking about the different treatment options for epilepsy. And so we had like it was a long 7-minute video, but we had cut that up into smaller videos that focused on, the intro and each treatment option. And
Mhm.
it was like a package on the branded portal. There were versions of it with and without the voiceover narration. So for instance, for a lecture, you don't want the voiceover narration. So it
Right.
was nice that I was able to, send him within seconds, send that to him. And the other nice thing I like about the brand portals is you can customize the URL. And so it's not, when you send the URL, it's not a bunch of gobbledygook coding. And also, as you add more assets to the branded portal, the URL stays static. So,
Exactly.
then, in one other case was some nurses they needed their headshots from the last year, and I had a branded portal with everybody's headshots and some group photos that I was quickly able to send to them.
Sounds efficient to,
Yeah.
use the branded portals to get the assets out and, topics around dam. I quite often use words like efficient and effective because that's really what a dam should do. And it sounds like you've really found some secret sauce there to not only be efficient, but be effective in your role as well in getting those assets out. Love to hear those branded portal use cases. Given with UCSF and given that it's, medical and kind of the healthcare realm as well, a lot of that comes with
Mhm.
security processes. So how has the dam really improved your security processes in relation to things like consent and usage?
Yeah, that's a good question. So yeah, whenever we go into the OR to take photos, even if we're just taking photos of the surgeon themselves, we have to have patient consent to go in there. And that's part of HIPAA, which is federal law that protects patient information. And so it's helpful to have, you know, prior to using HIPAA, we had paper copies of the patient signed patient consent forms in a cabinet on the 8th floor or in our building. But now we've scanned all those patient consent forms and then can upload them to HIPAA. And then using the related assets feature, where let's say I upload 100 photos from a video shoot, then I link that one patient consent PDF to all 100 in one step, connect to all 100 photos. So now, sometime in the future, if I'm doing a search and I find I find one photo from that photo shoot, that photo will be linked, or that consent form will show up as a
Right,
related asset. So that's really handy. Sometimes we do sometimes we do photo shoots with actors.
right.
and those actors also have consent. So be able to like look up their name, years later is important.
For sure. And it saves you time from having to say, okay, I've got this photo. Can I use it? Is the person,
Right.
has they consented, right? And then trying to figure
Yeah.
out all the paperwork, going through a filing cabinet. Yeah, it definitely brings you into the current realm of really dampening that single source of truth, finding everything that
Mhm.
you need right there. Love,
Right.
love to hear that. Given, with the communications team and being able to kind of use the dam to tailor your assets to individuals and send them out with branded portals. I know you're not using the Adobe connector as often, but can you share a little bit about how you're using Media Valet with Adobe?
Yeah. Yeah. Like for photo, I use it for Photoshop. Sometimes if I have a flyer, presentation flyer template that I will
Mhm.
use when there's a presentation. And so it's nice, if I need to, I make the adjustments in the text, but then I need to bring in a new headshot photo. And it's just talking about efficiency. It's just nice to, rather than going into Hippo, looking up that headshot shot photo, downloading it, and then uploading, embedding it into the Photoshop file. Within Photoshop itself, I can log into Media Valet, find that headshot, and then just drag and or insert it, drag and drop it into Photoshop. So it's just kind of it's a nice, it's just like kind of a good, it makes you feel like you're being
Yeah.
efficient, and it removes that extra step in the
It
process.
does. Yeah, I always talk about, removing the clicks. And what that means really is, how many clicks does it take you to get from point A to point B? And if we can reduce those clicks, that's efficient. And really that's
Yeah.
what we look for with those synergies between their integrations. Love to hear that, especially with creative files. What results or outcomes with Media Valet have you seen? Is there anything that you can kind of do now that you couldn't do before?
Mhm. Yeah. So I'm also like, I don't necessarily have like a quantitative answer to that, but like qualitatively, emotionally, there's like like a sense, a comforting, sense that a peace of mind, I guess, yeah, is the
Yeah,
phrase I'm looking for. There's peace of mind to know that we have all these assets in a centralized, curated place, so that when we do get requests or we ourselves need it, it's really nice to know, comforting to know that there's a place to go. And I think that following on that and what we've already talked about is the efficiency. I think
yeah,
that's something we clearly have seen is that we're more efficient. When I'm working on my own project and I get a ping email asking for something, I'm able to turn that around much quicker than having to track things down like we used to
100%.
have to.
Yeah, and I think, you touched on, just being able to be efficient in that it will save you time, but also it's a quality of life with the dam, being able to just say, I've done the job, it's done quickly, I feel good about it, all of the consent forms are there.
Yeah.
Really giving you that ease into the workflow is,
Mhm.
though it's qualitative, still very important. Love
Yeah.
to hear that. Um, from our chat today, there's been a lot of moments where I could say, well, that's a hot damn moment and that's a hot damn moment, but I'd love to hear from you. Could you share your hot damn moment and, an experience really um, where you were impressed with Media Valet or a time that it really helped you out?
Yeah, I would say my hot damn moment kind of relates to this efficiencies we've been talking about. I mean, there was the Adobe connector, but this particular moment was when I needed to email a large video file. It was like probably a gigabyte or higher, and I certainly can't email that. So, in the past, I would upload that video to some cloud platform, uh, get the link, copy and paste the link into the email, and then send the email. But Media Valley has a widget, Microsoft Outlook widget within Outlook. So I just clicked on that widget, logged into Hippo from there, found the video I was looking for, and then inserted it right into the email. And so then I didn't have to worry about the size limitations. And also when
Right.
I insert it, it inserts it with the file name, which it's a nice touch because a lot of times these cloud-based platforms when you copies and paste the gobbledygook, the long
Yep.
coded, the code and the URL. So yeah, that was definitely a hot damn moment where I felt efficient and it was seamless to work
Love
within
that.
Outlook.
Yeah, and as you said, kind of connecting the system to Outlook, reducing the clicks, something I talk about
Mhm.
often, but then also just giving that peace of mind of like the file name is great, like it just easily gets there. That's a great hot damn moment. Thanks for sharing that, Todd.
Mhm.
Um, really kind of the last question I have before we get to the other panel questions here. Is there any advice that you would give other organizations going through a similar journey, whether it's advice looking for a dam or now that they have the dam set up, any advice that you would
Mhm.
give them there?
Yeah. Yeah, I would say when I first joined, and I mentioned that one of my first tasks when I joined was to implement a dam, and I had never heard of dam before. So, um, fortunately, there was a conference like a month after I joined, a dam conference, an in-person one back before COVID. And so that would be my first piece of advice is to go, if you're new to DAM, it's okay, go to either a virtual or in-person DAM conference. It'll really open your eyes to the whole world of DAM. And so that's one piece of
Mhm.
advice. The other one would be to talk to stakeholder, like people, different roles in your organization and department, and have one-on-one sessions with them and try to find out their pain points with finding assets or why they even need assets. That'll kind of give you an idea of how a dam might be helpful in your organization. And then third idea would be as you're doing that kind of work to come up with a short, concise mission statement for your dam. It'll kind of be your true
Mhm.
north. Like, whenever you're questioning things or trying to figure things out, you'll have that mission statement to rely on. And along with that is having user scenarios. This could be real people or, a fictional person, like a fictional, in my case, fictional surgeon who, recorded a video and he needs to use it in his presentation. Kind of write that out because
Yeah.
if you're in the if you're in the early stages of communicating with prospective dam vendors, or you're trying to figure out folder organization, having it at least just thought through those user scenarios will help.
Yeah, it
Um,
kind of gives you that
yeah,
big picture almost, right? Of all the different use cases that
yeah,
you could use a dam for, whether you start with all those use cases or grow into them. I think
right,
that's
right,
really important. And
yeah,
I think that's great advice there. Any
yeah,
other advice
yeah.
that you have there?
Yeah, I was just going to say, that helps with communicating with the
Hmm.
vendors. And then the other thing I thought is that, yeah, certainly DAM isn't a static product that and, my thinking has changed over time. Like I used to get very anal about filing naming conventions, and I've kind of realized that keywording and metadata might be even more important than the getting caught up in the how you name a particular file. So yeah, so kind of always be thinking about how you can be updating stuff is
Yeah.
important.
That's fantastic. Really great advice. And I think for people who are either searching for a dam currently or currently have a dam, I think that's advice that they can all take and say, okay, even if we need to revisit our dam and, build and grow, it's having those use cases and understanding, all the different workflows and understanding how the brain would function, if the brain was the dam, right? All those
Yeah,
neural links, right?
yeah.
No, thank you so much for that advice, Todd. And thank you so much for all of the feedback today.
Mhm.
Thank you for sharing your story. I'm sure for those that attended today, it was highly valuable. Just before we jump into a couple questions, wanted to pull up a quick poll. So you'll see that on your screen here. If you wanted to hear about any of the features that we talked about today or learn more about the workflows, please let us know in the poll and someone will reach out to you. We'll give folks just a little moment here to fill that poll out.
Can I answer the poll?
Yeah, by all means. Perfect. Let's get into, I think there's a question here coming through on my screen. So with the kind of the UC, if we were UCSF is your field, but with UC, do other UC areas have their own dam, or do they also use media valet? And if so, how do they kind of intersect?
Hmm. Yeah, I mean, as far as so at UCSF, the Office of Communications, they do have their own dam. It's a different vendor. Um, and I don't know of other, um, yeah, that's so yeah, there isn't, different, our
Mhm.
department saw the need for it, so we invested it in ourselves. And as far as like the UC wide, I don't know. We do. I am in communications with other video producers at UC, but I haven't
Could be a
talked
future
about
state.
them. Yeah,
You
yeah,
could always bring them in at some point,
yeah,
right?
yeah, yeah.
Absolutely. Another question here, some good questions coming in. You store patient info in the dam, and I think that kind of brings back to our kind of consent
Mhm.
forms that we talked about. How do you monitor security with that?
Yeah, so I mean, first of all, we had to get, when it came to choosing a dam, we needed a HIPAA compliant dam. So that actually ended up being kind of a good thing because it kind of narrowed our choices. Um, so we had to set up, I forget, there was all sorts of like business agreements and then technical things when we actually got the dam up and running. We do have two different sections of our folder organization. There's one it's kind of duplicated. So there's a duplicated set that's just for the media team, and so the media team has a few extra things that
Mhm.
the main one doesn't. And one is the consent form. So we only keep the consent forms in there, so only the media team can get at that. But we do. These are all people working in health sciences, and there's surgeons and residents that are dealing with patient information, so they know that there's a certain level of security that needs to be taken.
Absolutely. And I think, having the different category structures that you have where you have the ones that only, your team can see and then the other ones as well, really kind of talking about the granular permission levels within Media Valet of you can, restrict what people see and you can
Yeah,
restrict what people do.
right.
And that really helps with the security clearance there. And then having something HIPAA compliant as well is a huge bonus there as well.
Yeah,
Just
and we give out user accounts, so we can monitor who has it, and when somebody leaves the university, we usually close their account and stuff like that.
absolutely. Not sure if I have any more questions here. Just pulling through lots of good chat, lots of positivity in the chat, which is wonderful to see. Question here. Do you use an EIM or ECM with the dam? If so, which one?
I don't know what an EIM or ECM
I'm not
is,
sure
but
either.
maybe we don't.
Oh, Enterprise
Oh,
Information
information
Management.
management. No, we're not using that.
Right. All good. Okay, I think we're all good on questions. Well, Todd, thank you so much for your time
Sure.
today. It has been a
Yeah,
very fruitful conversation. Always a pleasure to spend time with you and learn about your dam journey. And very excited to see how you grow Hippo and to make it bigger and better and as the years go on. Thank you
great.
so much for your
Yeah,
time today, and thanks for everyone for joining today. Have a good rest of everyone's
yeah.
day.
All right. Bye. See
Bye,
ya.
Todd.